Hello and welcome to the Ask Dr. Gil podcast. I'm Dr. Gil Winkleman, and today I'm doing a quick video on traumatic brain injury, otherwise known as concussion or TBI, and those terms are used interchangeably. And I'm going to go through some of the problems with TBI that show up, symptoms, and why a lot of my patients don't recognize the symptoms. And I have more information in a podcast. So I'm going to be redoing that podcast as a video podcast simulcast as well, which will be longer than this intro. But I wanted to kind of give an overview of everything. So worldwide, and some of these numbers are old, just so you know, because the data keeps shifting. It's really interesting, and I'm going to explain why this is. So brain injury is one of the, if not the leading cause of death and disability worldwide. And for those of you who have had one, you understand how debilitating it can be, particularly before you get treatment. And the treatment options are in mainstream medicine are not great, to be honest. And so this is where I really feel alternative medicine has been shining really well. So, but in terms of worldwide, the numbers vary. And in terms of incidence, and I've seen them as low as 369 per 100,000 to about 1,000 out of 100,000. And the problem is that the lower end of these numbers are really reflecting people who got treatment. And there's lots of people clearly that are not getting treatment. And I'm going to explain why that is in a minute. In the United States, we see about 250,000 people are hospitalized and survive. And many of these people end up with long-term, potentially lifelong disabilities as a result of the injury. The research, according to the CDC, suggests that 5 to 10 million people today, 5 to 10 million Americans are living with disability related to TBI. The problem is that we've got this large group of people who don't get treatment and they start to have cognitive problems. They forget appointments, they make bad decisions, they self-medicate as a result. They might be fatigued or have mood issues or challenges relating to other people. And here's the question. Why is it that so many people either don't recognize that they had an injury and or don't get treatment for that injury? Well, some of this has to do with our anatomy. So when we look at the head, it's basically our head and neck is like a bowling ball balanced on the end of a broomstick. The head weighs 10 to 15 pounds, and our necks aren't really that big, are big and strong, right, for most of us. And so there's a wobbly action that can happen with that, right? So when you look at a lot of problems that we see, it's actually not hitting your head necessarily that's the issue. It's the whiplash issue that happens as a result of this weight imbalance. And further, making this problem harder is that when we look at the consistency of a brain, it's kind of like an egg. There's a gelatinous feel to it. It's a little more structured than a raw egg, but think of it like Jell-O, right? And then it's impacting the skull, which is like a brick wall. And so there's going to be damage with that happens. And as a result of that, the brain sometimes, there's a lot of issues that I won't go into now. In terms of what we see, we do see that the issues show up in either a physical, a cognitive, or an emotional behavior problem. Now this, by the way, this graphic is on my website and at AskDrGil.com, and there's a link, there's a blog post in there about TBI. You can search it and find it. The thing about it that's interesting is that we see problems that can span across systems, and it can be neurological, but it can also be mental, emotional, psychological. So headaches, neck pain, and by the way, migraines can show up post TBI as well. And I've had a number of patients I've treated successfully for migraines that then remembered subsequently, oh yeah, I hit my head 16 months before the migraine started, something like that. Tension and concentration issues, difficulty reading, easily getting confused, lack of energy or motivation, change in libido. It can go up or down, libido with head injury. Changes in sleep habits, appetite changes, dizziness, loss of balance, ringing in the ears, and mood changes. Those are the big picture of what this could look like. So the consequences is that people will have long-term issues that they don't know where it's coming from because they've forgotten what's happened. I think sometimes the brain injury issue gets confused because there can be an inflammatory component as part of this. So I want to thank you for joining me for the short video on traumatic brain injury. And I will do another video about the treatments for this. And I have a couple of articles out on the internet as well as on my website, askdrgil.com. Really hope that you got something out of this. If you like this, please be sure to like it, as well as follow me because I'll be putting more of these out, and check out my podcast as well. And if you have any questions, feel free to write a comment down below. Thanks so much.